I think it's a procedure that in a clinic set out like this is good for patients.
Yes, very good.
And I was told that you're one of the center that have treated the most patient using the resume. Is that true?
Yeah, that is true. 안녕하세요. 서울리더스비뇨의학과 원장 정재현입니다. 오늘은 리줌 회사죠. 보스턴 사이언티픽이라고 아실 만한 분들은 아실 거고 처음 들어보신 분들도 계실 겁니다. 국제적인 회사고요. 보스턴 사이언티픽의 아시아 태평양 지부 헤드, 마케팅 헤드가 싱가포르에 계신 분이세요. 근데 이제 국내에 도입이 되고 저희 서울리더스가 시술을 가장 많이 해오면서 국내에도 아주 성공적으로 정착을 시켰다는 점에서 보스턴 사이언티픽의 아시아 태평양 지부 마케팅 헤드께서 저희 병원에 감사 인사를 전하고자 오늘 방문을 하였습니다. Can you introduce yourself?
Hi, Dr. John. Very good day to you. My name is Derek.
Derek.
I'm the Senior Marketing Manager for Asia Pacific, taking care of urology business across the Asia Pacific, serving the doctor like yourself as a urology division.
Okay, in Boston Scientific, corporation,
So this time, the reason I'm here is to thank you that you are one of the center that adopt the water vapor therapy resume in the Korea.
Oh, thank you.
And I think we have launched this product in Korea about almost 6 months, and I was told that you're one of the center that have treated the most patient using the resume. Is that true?
Yeah, that is true.
So how many patients you have treated so far?
Also more than 50 patients. After 50 patients, until 30 and 50 patients, I checked all of the patients and make the list.
Well, he doesn't check that after the.
I see.
Yeah.
But
because he already done many things.
but the patient all happy?
Most of the patients happy.
So usually you treat like how big is in average how big is the postage that you?
About between 40 and 60.
So it's
so there are few people over 70.
Okay.
70.
Okay. So I think that is quite common in all the resume practice.
So minimal size was 31 and the maximum size was 79.
So you fall within the guideline of 30 to 80 grams. Yeah. So far, I think this is a procedure that what I receive from a lot of doctors. I spoke to those doctors have been using resume. They teach me something that it's a procedure with faith, because you may not see the result immediately, but definitely we see the improved result after 3 weeks and 3 months, and you're getting better and better. And we have the 5 years data. I believe you also read about it, right?
Yeah.
So once again, the main purpose is to thank you for having faith in this procedure and to bring the good news to the patient.
What about in Singapore? Is there many patients who receive resume in Singapore?
So Singapore we launched a bit earlier. Okay, in fact, in Asia Pacific, we have a few countries we launched a bit earlier, like Hong Kong, Singapore, Thailand, and also Japan. We launched it much earlier.
When it started in Japan?
Like two years ago.
2 years ago.
And Japan.
And about Singapore?
Singapore also about 2 years ago.
2 years ago.
Yeah. So just to share with you, last month in March, we celebrated 1,000 cases of resume in Hong Kong.
In Hong Kong, 1,000 cases.
Yeah, you know Hong Kong, Singapore, all these are small countries, right?
I know.
Small population, and we celebrated 1,000 cases in Hong Kong in last month, and 2 weeks ago we celebrated 1,000 cases in Thailand.
1,000 in Thailand.
Yeah, and Singapore and Malaysia is also hitting 1,000 second half of this year. Yeah, Singapore, small country. Population of 5 to 6 million, but in among all the Asia Pacific, I would say that Japan has the highest number right now.
In Japan, highest number.
We close to 4,000.
4,000.
Yeah. It may be because it's partly because of the population.
More population in Japan.
Yeah, aging population as well. All this, I think that's why in this BPH.
In private clinic or in
both
hospital, university hospital.
Well, the one thing is that the difference between Korea and Japan, because Korea is a non-reimbursed market and Japan is a reimbursed market.
Yeah, but Japan also takes some time to get the reimbursed. Yeah, so it's not when at the beginning, only at the later part they got. So I'm very confident that because in Korea we launched Resume a bit later, only last year. But I have very high confidence that Korea, very soon that the doctor have the getting hand on this, and then the Resume will go up, because patient will have word of mouth. They learn about this benefit. Patient will kind of knock the door and say, "Doctor, I want to have this therapy."
Maybe close to 1,000 in next year in South Korea.
Yeah,
I guess.
Yeah, I think I think if within 1 year it's easy. And you see yourself, you already more than 50 cases in 6 months, right?
Because the Resume machine is not popular, not generalized in South Korea.
So far, everything okay for Resume? You're happy with it?
Yeah, so far, everything is okay. Very less complication and high quality.
Thank you. Yeah, I think that Resume is a procedure is quite straightforward, and it although the guideline is we put 30 to 80 gram, and then we can treat preserve the erectile or this, and then there's a lot of benefit. Less complication, very low resurgery rate, and then
very low resurgery rate.
Yeah, I think that is something that the patient need to know. I think the patient a lot of times they need to learn from the doctor, the consultation. The doctor explain to the patient. Although it have a longer catheterization, number of days of
catheterization day, about most of people between 3 days and 5 days.
3 to 5 days. Okay, then they
days,
remove. They are okay with that, right? So I think it's fine.
Less than 1 week.
How about, you see, for Resume, another benefit is that they're able to treat patient prostate with a medium lobe. Right. So how many percentage that your patient receive come with a patient medium lobe enlarged prostate?
Yeah, I didn't expect it. Median lobe patient. Very many patients has median lobe. I was wondering about the result of the Resume for median lobe. Very good quality and very good result for median lobe. No complication at the rectum or other organs.
That's true. That's true. But anyway, that's a really good news to learn your experience in Korea. Definitely I will want to visit the center again, visit you again to hear more about your experience when you hit 100 cases. Very soon. Then I'll book my air ticket and fly here as
Maybe 3 months later, then you can come back.
Next year I will invite you to South Korea.
Oh, definitely.
You should promise, come back to like a 500 cases and celebration together.
Yes, definitely. Maybe we should celebrate together for the case. Yeah, it's a very good milestone, and I believe that you're getting more and more because you're so used to this already. You just showed me the 10 minutes. I think it's a procedure that in a clinic set out like this, it's good for patients.
Yes, very good.
Well, thank you very much for your time. I just want to say thank you again for this time I visit Seoul. I get to meet up with you.
Thank you for visiting our center.
I heard so much about you, but I really appreciate you get time to meet up with me. Thank you.
네, 감사합니다.
Thank you.